Well, good afternoon, Facebook. It is 12:30 on this Friday afternoon. That means the doctor is in. Today, we're happy to welcome Dr. Jonathan Holmes with Children's Medical Group. Thanks for coming in.
Thanks, Devin.
We're talking about a subject that both adults and children have to deal with, seasonal allergies. And fortunately, I don't have a lot of that, but people who do, oh boy, they're miserable.
It's awful.
It is terrible. And when you talk about a child having allergies, that's bad. So we want you to ask Dr. Holmes your questions. We're going to talk about what causes the allergies, how to treat the allergies. We're going to dive into all things seasonal allergies today. All right. So I didn't realize that it was already allergy season.
It seems early, but
Yes.
for those that live down here, we know that it is all year round. It feels, and it is. A lot of times allergies down here kind of vary on what causes it, but from February all the way through spring, we see tree allergies. You know that yellow stuff on your car windshield that you see all the time? That is actually from pine. So we see a lot of tree allergies through these beginning spring months. Through the summer and fall, it tends to be ragweed and it tends to be grasses as well as molds, and that lasts all the way through November.
Right, because you think about this time of year, the grass is not green. We don't have a lot of flowers out. You think that allergy sufferers would be kind of enjoying this time of year. But you're saying, nope,
we're kind of wrapping it
something.
up. We can enjoy December, January, and February, and then it just tends to fall off after that.
I would imagine March must be completely miserable.
It starts in pretty heavy then, and as I'm an allergy sufferer myself, you can always tell when you get that tickle and sneezing episodes and everything starts to work its way in, and that misery really starts to hound at you.
All right, so let's talk about children. They're not exempt from allergies.
That's correct.
And so what do you see with parents coming in with children?
A lot of times it's my child has lots of sneezing and my child has a dry cough, but there are other things that can be a little more subtle and still helpful in making the diagnosis. Watery eyes, throat clearing, sometimes rash after being outside, can all be more subtle symptoms that exposure to an environmental allergen is actually triggering their symptoms.
And you know, we talk about, and we're not talking about food allergies today, but we do invite you to ask whatever question you have to Dr. Holmes if you do want to ask about that. But like sometimes with food allergies, they grow out of them. But do you see people growing out of these seasonal allergies? Because this is an adult problem too.
Yeah, that's a tough question with a yes and no answer. You can grow into allergies and you can grow out of them. There's only one predictive model or piece that we use that tells us that we're probably going to have them in adulthood, and it's called the Allergic Triad or the Atopic Triad. And that's if you have asthma, eczema, and allergic rhinitis. Now, if you have all three of those, you can bet your bottom dollar you're probably going to keep those as an adult.
Oh, wow. All right, allergic rhinitis, because we do have that on the banner at the bottom of the screen. What is that?
That's the actual diagnosis that we give: the runny nose along with the throat clearing and the puffy eyes, watery eyes. Sometimes you'll see the allergic salute.
Oh, yes.
All of that kind of falls into the diagnosis of allergic rhinitis. And what's really going on there is in the nose we have these big pillows of tissue. They're called turbinates, and sometimes they can be inflamed. The nose kind of works as a filter to the outside world, but as it filters, it can become inflamed. And that's what's dripping and causing all of the symptoms that we see later on.
You know, because you always seen, I remember even in childhood, children that just always had a runny nose.
Yeah.
And I wondered, okay, is it their immune system? But I never really thought, oh, it could just be allergies.
Yeah, it's a good question. Sometimes as children are developing their immune system, we get exposed to multiple viruses over and over again, and it can be tough to decide if that's allergies or colds. But the difference can really be in how they present. Usually people and children with colds have this period of resolve. It's almost like a roller coaster. They get a little bit better and then they get worse, and then they get a little better and a little worse. But typically with allergic rhinitis, it's just kind of a low level. It's always going to be present and consistent. Sometimes too you can use color of nasal discharge to give you a little bit of a marker as well. With allergic rhinitis, it tends to be clear. Rhinorrhea is what we call runny nose, but sometimes with infections it can get more of a colored green or yellow or sometimes even orange or brown.
Oh, wow. So if it's clear, oh boy, what a lunchtime topic today. So if it's clear, then that could be signaling more of along the allergy route.
It could, or it can still be virus.
Or still could be.
Yeah.
I mean, oh gosh. Okay, but what about the cough? You talked about this dry cough tending to be associated with allergies. If it's that deep chest cough, is that not allergies then? That may be an infection?
It could be. A lot of times a good listen with a stethoscope by a professional can tell if there's an infection in the lungs. We've got to rule out pneumonia. pneumonia. A good evaluation in the back of the throat can tell if there's postnasal drip, which in the case of infection may not be present, where in the case of allergies you'll see something maybe on the back of the throat, which we call cobblestoning sign. And that can be indicative of postnasal drip for long periods of time and can sometimes give the practitioner guidance on what's really causing the cough.
Wow. And it is miserable because a lot of these children too are awake at night with it. They're not sleeping well. So what do we do for, or when do you start to medicate a child? I mean, what's too young to start giving allergy medicine?
That's a great question. I'm going to answer that one, but I also want to touch on the nighttime thing that you just brought up real quickly. Sometimes it may not be an outside allergen that actually triggers your symptoms. Sometimes we can have dust mites in our pillows.
Oh, wow.
And every time we go to sleep, we get access to the pillow, and kids wake up in the middle of the night or even that following morning, stuffy with swollen eyes, and it's from the dust mites. So we always recommend, if we have those types of symptoms, maybe changing out the pillows every 6 months. And sometimes you can get covers, although they're not terribly effective. The hypoallergenic mattress covers and pillow covers are another way to do that.
Because now that you say that, I mean, my son wakes up every morning sneezing. Doesn't have allergies all day long. And I need to check the pillow.
When was your last pillow change?
I think recently, but I'm ashamed to admit, I don't know, because we kind of have like musical pillows going on in that house. Everybody wants the most comfortable pillow.
You can also get a pillow that you can wash in the washer now. So they make a lot of those pillows available, so you don't have to keep buying them, but maybe just wash them, and that's fine.
What about mattresses? I mean, that's not something we buy very often. Could do the mites get in the mattress?
They can, but mattress covers are the best way to help kind of get past that problem. On the topic of treating in pediatrics, sometimes we can treat all the way down to 6 months with something called Zyrtec. Zyrtec is what we call a second generation antihistamine, meaning it doesn't make the child sleepy like Benadryl does. But typically, children, especially under age 1, don't have environmental allergens. It's not absolute, but the reason is this: a lot of times you have to have a second exposure to the season to become sensitized to it. A child or a baby can see the first season and then will have symptoms, but maybe due to a cold or something. But if they're older, you know that they've seen that second season and maybe become sensitized to whatever allergen, like the tree or the grass that it was. So it's very rare for us to see true allergies under age 1, other than in the case of milk. Milk allergy is the most prominent type of allergy seen in babies. But Zyrtec and Claritin are the good starting spots for treatment of that. There's also things that are more strong called levocetirizine, which can be prescribed by a provider. And then also have things like nasal sprays. So nasal sprays can be helpful too. Not Afrin. We try not to use that.
I've heard
Sometimes that can cause a rebound effect where if you stop using it, the symptoms rush right back. But a better nasal spray would be something called Nasocort or Flonase. And these are low-dose steroids that, when sprayed into the nose and combined with an antihistamine like Claritin or Zyrtec, can really make those symptoms dry up and go away. One quick side thing, though, is when you use that spray, we always want to aim it to the outside corner of the eye. We don't want to just stick it straight in and blast it, because it may drip down the back of the throat. It may taste bad, and it's not going to work. It's going to waste your money. So we want to aim to those turbinates that we talked about, and the best way to do that is to aim to the outside corner of the eye here. And sometimes you have to stand in front of the mirror and do it right the first few times. But you'll find a much more effective treatment course if you do that.
That's good for adults to know as well.
Absolutely.
I mean, that can be hard if you're talking about a 2 or 3-year-old with allergies. They are going to be running away from you if you try to squirt that up their nose. And that's a hard thing to have to deal with, because it might be a daily thing for a lot of parents.
That's a good point. Sometimes the nasal spray isn't a home run for a toddler, and that's absolutely something you got to keep in the back of your mind. And which battle do I really want to pick today? But in a lot of cases, the antihistamine alone can be done. They come in chewable forms, and they also come in liquid forms. The key to an antihistamine, though, is to use it regularly. A lot of times I'll have patients that say, I use it now and again, but the symptoms are still persisting. Well, that's because in order to be really effective, an antihistamine needs to be used on a daily basis until the season is over. So sometimes that can be a month or a couple weeks or even longer. And then once that season is done, and I'll tell my patients, use this for about a month. Then we kind of come off it if it's mild.
Okay.
And if the symptoms rebound, then maybe we need to be on it for another month. And so that way we don't have to be on the medicine all year round maybe, but not just kind of as needed, not getting a great treatment course.
You're saying so a lot of people just don't like the idea of giving their child a medicine every day for, say, a month. But if they're that miserable, they may just be glad to find something that works.
Exactly. You know, it's a quality of life question. If the kid and the parents are absolutely miserable from allergies, then a treatment might be necessary.
Right.
And you can only limit your exposure to outside so much. So that's where the medicine can be really helpful.
Right. Okay, so we talked earlier about allergy shots, but that would be something you were telling me that would be almost more of an extreme case.
Yeah, so if we've gone through our typical algorithm of treatment where we've tried antihistamines and tried all the lifestyle changes, nasal sprays, we'll typically recommend maybe an allergist to follow up with. Now, allergists have a couple extra tools that as primary care physicians we don't have, which can be like skin prick testing, as well as blood testing on what are exactly the children allergic to. And if there is something that's found that they're terribly allergic to, a lot of times they can do kind of an immuno shot that helps calm the body's immune system down when they're exposed.
Right, and you're talking about, I mean, I've heard about that, drawing the grid on their back.
Sure, yeah.
And, you know, oh, it's cats. I knew it was cats, or it's dogs, or it's grass. But it's the worst is when it's something like grass, and I'm sure that's a common one.
Yeah, we see lots of grasses and molds and trees, cats, dogs, and then the top 8 food allergies can sometimes come up when they test for that, and that's always kind of a big package that's done. We call it a skin prick testing. It can be uncomfortable, so little kids typically don't do well, but when they get a little bit older, it's nice to know what is causing this.
Now, for food allergies, they are not presenting in the same way that seasonal allergies are. Usually, is that more stomach related?
It can be stomach related or skin related sometimes. You know, a lot of times it's what our GI tract is exposed to is going to show us the symptoms. So yeah, it's upset stomach, sometimes a rash around the mouth depending on what the actual allergen is, but it can vary, and food allergies are very tricky sometimes to try and find what it is. Usually an elimination diet is the best way to start that process.
And you talked about the top 8 food allergies. You mentioned milk is number 1.
So milk is popular, especially under age 1, but so can things like we have shellfish, as well as soy products, and of course nuts and wheat. These are the biggest ones. Eggs as well are kind of the most popular types of food allergies we'll tend to see emerge.
And what percentage of children tend to grow out of those?
Well, the actual milk allergy, a lot. As they're infants, you know, a lot of times by age 1, most will grow out of that allergy. Some will keep it, but for the other types of allergies, they may come and go anytime in our life without much rhyme or reason, and that can sometimes be troubling. You wake up on your 40th birthday, and all of a sudden you can't eat ice cream anymore.
Oh, wow!
That can happen at any time. But typically, ice cream, and as we talk about dairy products, that may not be so much an allergy as it is what we call an insensitivity. And it's just the processing of lactose and the inability to do that, which sometimes for the majority of people maybe need to limit some of the dairy that they have.
Right. Okay, so that's a whole different topic for another day, and we probably do need to do a segment on that, because
that would be good.
It seems like, and we were talking earlier, there are more children being diagnosed with food allergies, and maybe it's because we know so much more now than we used to know.
Yeah, it could be that we know what to look for and how to test. Now we have more specialists available. Or maybe there's something grander that we don't know.
Right. Well, before we go, Dr. Holmes, if someone is watching and their child has seasonal allergies, it sounds like to me your message to them is just don't ignore them. Your child is probably very uncomfortable, and everybody else is having to listen to this sneezing and coughing going on in the house. So you need to get it checked out.
Especially it's good now to see your primary care pediatrician. Make sure there's no infection going on. We're always trying to trace those things. But really, if kids are having allergies and we notice that every time they go outside and come in, they have these symptoms, or every time they touch the cat or dog, their hands are rashed up, or they have kind of swollen eyes and sneezing, that we try and eliminate the allergen and then treat with some antihistamines. And antihistamines are safe for kids. We know that. We know that it's a well-tolerated medicine and comes in many forms. So if your kid is telling you something by their sniffly nose or their sneezing episodes, it's good to listen. And
with one last thing, I just want to touch on this. You mentioned that we're talking about the flu, we've talked about COVID. You were saying you've seen very little flu this year.
That's true. Yeah, there's been a lot of social distancing, we've seen mask wearing, and I think that limiting large quantities of people together have probably stopped the spread of most viruses, and flu falls into that category. Same with other viruses like RSV, which is respiratory syncytial virus. We've been seeing very low numbers of that, and overall that's probably because we've been doing a pretty decent job at trying to stay apart and allow our immune systems to work their magic without spreading.
What about COVID? I just feel like I need to ask you because I have you here. Are you seeing a lot of COVID cases in children?
So we're not seeing as many in children as adults. There are positive cases, but they most likely come from other family members that are living at home. In general, kids are doing quite well with the illness or may not even have a lot of symptoms. That doesn't necessarily mean that you shouldn't bring the child in though and get them checked out and still follow all the local and CDC guidelines.
Right. Okay, well, Dr. Jonathan Holmes, thanks so much for being our guest today. We appreciate all your knowledge, and we want to thank all of you for watching The Doctor Is In. Before we go, Dr. Holmes, tell people if they would like to see you as a patient, where you're located.
Sure. I am part of a group called Children's Medical Group. We have a location on Airport Ave behind the IHOP, as well as on the Providence campus. They can call the number 639-1300 or come on down. We also have a website called cmgdoctors.com.
All right, Dr. Jonathan Holmes, thanks so much for being our guest.
Thanks, Devin. Appreciate it.
And thanks to all of you for watching The Doctor Is In. I'm Devin Walsh. I'll see you tonight for WKRG News 5 at 5.